Anesthesia. This can be general anesthesia, regional anesthesia, sedation. In general anesthesia, there are 4 aims. Number 1, analgesia. Number 2, less loss of consciousness. Number 3, amnesia. Number 4, muscle relaxant. Induction is IV or inhalation. Maintenance is sedation with propofol or midazolam. Respiratory tract infections increase risk of laryngospasm and bronchospasm. Malignant hyperthermia. It's autosomal dominant, triggered by inhalation agent or depolarization agent, such as succinylcholine. It causes prolonged muscle relaxation. Release of potassium can lead to MI. Release of myoglobin can lead to renal failure. Antidote is dantrolene. Regional anesthesia, mixture of morphine, fentanyl, or bupivacaine, propofol for sedation, reduce confusion and lethargy compared to GA. In regional anesthesia, they can be spinal or epidural indwelling catheter, interscalene block, suprascalpal or axillary block, facial eta block, or adductor canal block. Sedation is done by midazolam. Antagonist is flumazenil. Morphine antidote is naloxone. Meta-analysis in 2009 shows comparison of regional and general anesthesia for total knee replacement and hip replacement, showed improved outcome in patients who had regional anesthesia. There was reduced need for transfusion, reduced incidence of thromboembolic events. Others have stated reduced incidence of loss of consciousness, reduced risk of readmission, UTI, and surgical site infections with regional anesthesia. Regarding local anesthesia, they are basically block nerve conduction by reversibly binding to sodium-potassium pump and blocking it. There are 2 types: ester local anesthesia, which consists of benzocaine and procaine, and amide local anesthesia, like lidocaine and bupivacaine. Maximum dose of lidocaine is 3 mg per kilogram, and with adrenaline is 6 mg per kilogram. Similarly, prelocaine has a dose of 3 mg per kilogram.